Hello. Thank you for your attending our SCIZER symposium, the subject with SCIZER fat reduction using non-invasive HIFU, lectured by Bertrand PUSEL. We will start our presentation with our doctors. Thank you.
Thank you, and welcome to everybody. So, for this symposium, we have two parts. The first one will be theoretical on the presentation of the device, and then in the second time, a demo of how to work with this kind of device. So, since 2007, Classes Incorporation from Korea provides some devices around the world for physicians, and they are quite the specialists with the EFU. EFU means high intensity focus ultrasound, and they have provide first two devices which are Ultraformer 2 and 3 for skin tightening of the face and neck, and also for the skin tightening of the body. And it's a pleasure and an honor to speak about today the new device, which is SCIZER. So SCIZER is a medical aesthetic device that provides non-surgical fat reduction treatment using macro-focus scanning ultrasound, MFSU, and the SCIZER is equipped with technology which delivers macro ultrasound energy at 2 MHz and 13 millimeters deep, safely and effectively. The SCIZER is equipped with a specially designed fat-shaped cartridge. The cartridge of the SCIZER is macro-focused with an emission area of 46 to 46 millimeter. And the device is available with 2 handpieces, and so you can twice shorten the procedure time. The highly satisfying procedure results in a visibly slim waistline, reduction in love handles with a minimal risk of side effects and no downtime. It's a kind of device, could be a lunchtime device treatment. High peak power technology effectively delivers ultrasound energy to the target area without heat diffusion to the surrounding tissue, with less pain levels and a low rate of side effects. The SCIZER treatment is based on the process of coagulative necrosis development. The treatment targets and reduces localized fat deposits to ultimately and effectively improve the contours of the body. Tissue temperature rapidly increased to 65 to 70 degrees Celsius with macro-focused treatment, destroying fat tissue through highly effective coagulative necrosis development, despite of the short time of the procedure. So on your slide, you can see the right here. This is the macro-focus ultrasound, and this focus point is about 5 millimeters long and 2 millimeters wide. And you can see on the schema just under that you have the elevation of temperature to be effective, and we need to be effective the level of 65 degrees Celsius. And there is, with the company, has done some preclinical study on porcine model. This article was published in a famous paper, and you can see with different stain the evolution of biopsy which were made on the first day and until 90 days. Which is remarkable is that the effect, the inflammatory situation begins very, very quick, and you can see in mauve here the colonization of inflammatory cells. And here with this stain, you can see the evolution for the decrease of the cells, of the fat cells in the tissue. So if we can do some ultrasound, but diagnostic to estimate the effect, you can see at post-procedure at 19 days the effect on the fat layer into the skin. This is a very new aspect also for this kind of device. The SCIZER is equipped with cool CC technology, that means contact cooling control. And this built-in cooling technology prevents the skin from heating or necessity of sedative. That means for the patient, there is no need of pre-medication, no need of anesthesia, and as I said just before, it's really a lunchtime procedure. So, which is this treatment procedure? The patient assessment needs two things that we will see in practice just after in the demo. First is a body mass index, BMI, of less than 30, and a minimum of 2.5 centimeter or 1 inch depth when conducting a pinch test. We just precise how to do a pinch test because it's very important for a selection of patients. Contraindications are not so important. Of course, on the area of the treatment, open or infected wounds or large scar are contraindication, as well as hernia on the proposed treatment area. It is also because it is implanted electrical devices, active systematic or local skin disease, metal stents or implants, pregnant breast feeding women, and redundant skin folds. Where are the different area indication? For the moment, this device are only one depth available, that is 13 millimeters. And for the moment, the application are reduced to abdomen, upper and lower part, also flanks and love handles, because we need this pinch test of 2.5 centimeters. And if you have not enough of the thickness, of course, it's very painful and it doesn't work. But in the next future, we hope that the company will prepare some surprise for the rest of the year with other handpieces like, I hope, 9 millimeters. So how do you do an operation? You need several objects, but very common one. So to take measure, a caliper, we'll see that is very important, a spray for water, a marking pen, a grid, and some tissue. How to use them? First of all, taking photography before the procedure in standard and reproducible conditions. That is important. And from the face and each side, left and right. Operation. First step, assess the treatment by conducting the pinching test. Step 2, use a tape measure to access the patient's abdominal girth. Step 3, outline the area of treatment with a marking pen. It's quite not very difficult. Step 4, mark the treatment area with the grid temporal. Operation, then setting the parameters and applying some water on the surface of the treatment proposed area. When you have some examples what you can do, and all the design you can see on the slides depending on your physical examination of the patient. And it is not very difficult. You have just to take time, and the time for the selection of patient is as more important as the treatment itself, because it's very important for the final result. You have an interface which is quite easy to use. We will see this interface after in practical it will be more easier. So we have seen the guidelines, and the principal guideline is to obtain in each site the energy of 180 joule square meters. The maximum of energy by cycle is 60 joule square meters. So at the maximum of 60 joule, the treatment needs a minimum of 3 passes or cycles in each site of the proposed treatment area. But this is very important because this device is very quick for the treatment, because each cycle is about 40 seconds. So the average time of each treatment is about 25 to 40 minutes. Yeah, on this slide, you can see what you have to do when you cannot use the maximum of energy, so you have to multiply the number of passes. This is very simple. So, for instance, on the slide, as you can see here on the last line, we have 60 joules, which is the maximum of the energy. You just need 3 passes. Of course, sometimes because sensitivity of patients are different, you have to decrease the energy by cycle. You have just to increase the number of passes. That's all. Okay? So, for instance, in the opposite, with a 30 joules maximum energy to be used for the patient, you have to do 5 passes. Okay? In this case, this is perhaps why the company has created a device with 2 handpieces to twice shorten procedure time. And by this way, even in the most bad condition with a very low level of energy, the average time of treatment is 30 minutes with 2 handpieces. The goal with this kind of treatment is the SCIZER provides an average of 2 centimeters reduction in abdominal girth derived by the EFU system. What are the potential side effects? In fact, I don't appreciate the term of side effects, because this is only following clinic symptoms, and these following clinic symptoms are not, from my point of view, really side effects. You can have discomfort and pain during the immediately and after the procedure, erythema or redness, and also as well as edema, but all these symptoms are resolving within 28 hours and without any problem. And sometimes, really sometimes, you can have bruising that may occur occasionally and resolve within 1 or 2 weeks. You will see now some clinical results. I used this device for the first time only 1 month, so the clinical result needs 1 or 3 months to get some real photography to appreciate the final result. So it is not my result, but I would confirm this, this result, because what is important is what you can see even in the first slide, that you have result even after the first months. And after the first month, for in this case of this patient, you have already a decrease of the measurement is 1.5, and it will be much more at 3 months post-procedure. And this is very important, because some of devices in the fat removal, you have to need very much time to get the final result. And this is very important because it's optimistic for the patients to get to this technology. So this is the same patient, and so a new one, which with a really fine result, dramatic result at 3 months. On profile 2, a new patient, The result is already done, obtained at 1 month procedure, as you can see here, with a good result, minor 3.5 centimeters. Profile. Profile. And of course, if you have a very thick fat layer, this is the limit of this technology, but the limit of most of the technology on the market, I suppose. This is not a miracle, it's just a technology that helped the physician to get results. And of course, if you are in this situation, you can do in the future more and more sessions, but you have to wait 3 months between the two sessions. It depends of the final result expected by the patient, but with this situation, you have already a very nice result at 3 months with 5.5 centimeters minor comparing to the baseline. This is a same patient on profile. And another one. And with this kind of slides, you can see the evolution between the first month and after 3 months post-procedure. On profile. So, which are advantages of the technique? It's a non-invasive fat reduction procedure. It's multiple treatable areas, but which are, I repeat, limited for the moment because the purpose of this machine is, for instance, for the moment, to have only depth available, and this depth is 13 millimeters, but it will be moving in the future with the arrival of other pieces. Built-in intelligent cooling system, and also we will see the development of the scanning of this device, which is very regularly. You have twin system, fast treatment time. That is very important for physician because 20 minutes is very important. No downtime, no anesthesia, no post-treatment requirements, and this is most important comparison with surgery. No stitches, no anesthesia, no incision, and this is very important because it's very anesthetic treatment with quite dramatic result. Specification of the device. You have the device just in front of you, and it will be detailed by one person with Elizabeth from the company. And thank you. So if you have some questions first, it will be a pleasure. For technical questions, Elizabeth from classes will be here. And after, we will just begin the demo. Thank you. Is there any question? Yes, please.
Hello. I would like to ask you one question, and thank you very much for the nice presentation. In case that the patient cannot tolerate this 60 joules, for example, does the EMLA cream helps? No.
No, absolutely not. Because EMLA, it was proved now, the action of EMLA, the limited in the depth is around 2 millimeters. Okay, so in fact, you have two possibilities. First, you have the cooling system, and I don't speak about it, but you can adjust the level of the cooling. It is not important in the first lecture, but you can do it, and it will be explained by Elizabeth. And second times, even if you have to decrease the level of treatment, it's not a problem. You have just a multiple the passes. So you have liability for treatment, and never. I've done only perhaps, for instance, only 20 patients, but nobody say, hey doctors, please stop. I prefer to run. No, absolutely no. It's very funny and very easily to do it.
Thank you.
Other questions? Yes. We want a model. We have a big model. Tu veux le faire? So, ben allez. So, Dr. Cartier from the French Laser Group will be the model.
How long for the session for small abdomen?
20
20 minutes?
minutes.
So we can use cannons to reduce pain, the protoxin?
No, we don't need. Really, we don't need. So if you propose to be a model, it's a surprise for me. So you will cry. Okay, so. So he asked for how much we pay for not crying. So we have to discuss before. Tu veux le faire là? Allez. Bah, tu vas remonter le. Enlève ta veste. Attends, tu enlèves toutes tes chemises. Oui, just speak in. Tu vas rester debout dans un premier temps. Non, mais c'est pour expliquer.
No shave.
No shave.
You sure?
Yeah.
No depilation.
No hair
I want
removal.
to keep my hair.
So the tie off. So what is very important when you do a pinch test is not to use the object, the caliper first, because the caliper first is not. It just serves for measurement. It's not action of pitching. You have to pitch you, and then you pitch, and then after you can measure.
Aye.
Okay? Because many times I have seen some doctors using this kind of thing to do this. It's not very precise. And even it's very important because in this area, for instance, I do the pinch test, okay? I have less than 2.5, so I don't treat. So first of all, is to design exactly the area of the proposed treatment. And this is area. So you can do lower abdomen, and upper abdomen. But I'm not sure the upper abdomen is nice. You have to make a pinch test. Okay? It's quite nice.
Thank you.
He says thank you. So this is the first step. After you can do some measurement. When you do the measurement, use this. This is the main problem for all this kind of technology, because most of you will say it's not precise, and I agree with you. But the measurement of this kind of proposed area, we have no technology, only 3D photography, but it's very expensive. But when you do measurement, you do the measurement and you try to be the most regular possible, and you measure not at the same level comparing to the ground, okay? Because, and so you fix at the first time, for instance, here is, and for the next measurement, you have a measurement, for instance, 98 centimeters. You do the same. It's not an irregular design. You have to take the measurement in 3 points at the same level measurement from the ground. This is the best things, and to limit the error and mistake. And then you can have some measurement at this level or this level. Okay? So, what you can do? Second step, as you have seen on you have a great template to define the area of treatment. So, and for instance, we have really limited the area of treatment. I don't do this lesion because I'm sure in this area it will be painful. Okay. Just one, okay. And this procedure takes time. I agree with you, but it's very important.
But you can delegate.
You, yes, you can, if you can. In France, we don't. Okay, so and you delimate all the square. We have perhaps a second band of treatment. Of course, you can delegate, but in France, this was a question of my friend Hugues, because in France we cannot do this delegating to people, so the physician has to do everything. Ah bon, tu me l'expliqueras alors. So only water on the area of treatment, and then we can treat. Of course, we will treat with only one pieces, but it will be the same with two end pieces. I just ask for the... Je peux plutôt ce côté-là ou d'autre? Okay. So just one piece. So perhaps we will describe the interface for the moment. Just show the device, Elizabeth, and just explain the different settings you can. So you can choose the energy and move the energy higher or less energy. And the second, which is very important, is the green light for cooling system. And you can adjust this cooling system depending on the sensitivity of the patient. And then you have also some possibility to reduce the shape of the treatment. In the external area, we can choose different shape to adjust exactly to the design of your proposed treatment area. So the most simple one is the plane, and we will do. You have some marks on the end pieces just to adjust the end pieces exactly to the design you have chosen. Voilà. So here we go. Stand by. Stop. Okay. So say nothing. It's 20 euros now, 30 euros, 40 euros. Yeah.
No.
See?
You treat?
We treat with the maximum energy.
No.
Hmm?
I don't feel nothing.
So, do you have a microphone for you? Okay. So what we are doing is one cycle or one pass. And to obtain the final result we hope, which was confirmed by the preclinical study, we have to do 3 cycles in each site.
Right, finished.
So finished for the first cycle, and then a second pass.
Right start.
Tu vas sentir un peu plus au deuxième et au troisième, mais c'est pas...
Tu dois attendre pour chaque cycle ou c'est immédiat?
Non, t'attends juste. So the question of Hugues is how much time do you have to wait between 2 cycles? It's just a question of 2 seconds. And as you can follow the treatment going on, you can just have your clockwise with you. It's a question of 50 seconds for each cycle.
On ne sait pas si c'est toi qui presses.
plus, mais je l'ai fait il y a 3 mois, c'est la même chose. Mais j'ai perdu, je te raconte pas. End of the second pass.
Right finished.
Okay, so next one.
Right start.
So there is possibility with the interface to just modify the level of energy between the 2 and first cycles. We have a position that is called preset 1 and preset 2. The preset 1 you will treat at the same range for the 3 cycles, and with the preset 2 you will have a decrease of energy by 5 joules by cycle. That means at the first it will be 50, and the second one will be 45, and the third one will be 40. It's just when people say at the end of each cycle that it will be a little bit painful.
Right finished.
Okay, so we have done one session.
Finish?
One side. If anybody wants to test the machine, I'm sure my friend will agree, and I just want to feel, if you want to feel how it works and the simplicity of this device. Do you have during the treatment, we do some interview of the patient. So the question to the patient, is it painful?
It looks like a home device. You don't feel nothing, but I suppose it works. You feel. We don't know if it's the pressure of the handpiece. You feel something, but very, very, very low. Was a little anxious. Sorry for, but you don't feel nothing. It's very completely different from shockwave or cryolipolysis. I'm very surprised. It's not because he's my friend, but I was very surprised by this feeling.
Okay, so what said you, Cartier, is very important because, of course, the EFU system could be an alternative way to the cryolipolysis or radiofrequency. And with cryolipolysis, as you know, everybody, it's a fantastic device, but this device is very limited by the real good indications, because most of the time you cannot treat really in a good condition to get a final good result many patients. And what is important with the EFU is liability, because you can really choose some area of treatment. You can really, perhaps, sculpting the abdomen on the treatment areas. Okay, so, do you have any question, or somebody wants to try the device?
If you have hernia or something.
Hernia is a contraindication.
Can you just after liposuction, do you think it's better you can maybe for large abdomen, maybe you can use before or after lipoaspiration surgical with cryolipolysis or with combined? That means the difference is 13 millimeters. That's right.
Yeah, you're right, because as everybody in the audience, the main things is we are physicians, so we have to choose the best technology for the best result. And sometimes, of course, if you can combine different treatment. And for instance, you can have people with sternburn fat and they want to get rid of, and they don't want any surgical procedure. So what do you propose? Okay, and it is this kind of technology is what I call sometimes attending or waiting technology, because even if surgery is the best indication, the patient doesn't want surgery. So you have a device that, by the fact you can propose something to your patient. And what you can propose is very, very light procedure, a lunchtime procedure to get in finally quite good results. And as I said during the lecture, you can also multiple the different treatment, just respecting 3 months during 2 sessions. But you can do 3 or 4 sessions depending of the patient expectation. Non, non, pour l'instant, il n'y a que ces indications qui sont sur le ventre. No. So the question of Hugues is, is there any other area for the indication of the technology? For the moment, with a depth of 13 millimeter and for safety, the only indication are abdomen and also flanks and love handles. Because most of the time, when you want to treat arms or tight, you need to get to have hand pieces with less depth. But it will be in the next future, according to the company, and it will be a very, very next future. Of course, this technology is CE approval, and you can treat without any problem, and the company is now well known around the world for the serious, then there is absolutely no problem. This technology has been verified from preclinical study on animal model, but of course also on human models before to be on the market, and really it's a really fantastic device. Wow. So the question for Elizabeth, because I have no answer, how much treatment do you have with one hand pieces?
The one-hand pieces can treat it 55 to 70 patients to whole abdomens with one-hand pieces.
And which is the price, of course? The price of the hand pieces.
It's not set in the European market yet, so we have no price yet.
And do you have an idea of the price of the treatment for with only the hand pieces? You have an estimation for the price of each shot?
It's very difficult questions for me because I don't have any decisions.
Okay.
Right start.
Est-ce qu'on peut avoir des hématomes, du bruising,
Oui,
des choses comme ça?
un petit peu.
Mais moins qu'un cryobolisme.
Rien à voir.
Ça, il faut le dire quand même.
Je l'ai déjà dit. So Dr. Gatier insists on the fact that you can have sometimes bruising, but this bruising is less important than one you can have with cryolipolysis.
Est-ce que tu as de l'œdème, un swelling après?
Légèrement, non pas. C'est l'érythème, c'est tout.
No swelling.
Non.
Jamais de déchets de paradoxique là.
Temperature at 45 and 50. You were saying you could do it higher.
Yeah, the maximum is 60.
Okay. Would there be pain at the higher levels?
We'll try.
Sorry.
So,
Sorry about that.
come on. Okay. Okay, this one. So the question of one of our person in the audience is, in fact, she has seen it was only 50 on the screen, and she wants to test with the maximum level. So we do.
Can you do 10 passes?
Le maximum?
Sorry?
10 passes, can you do
if you choose some less level,
Ouais, on va pas déconner non plus.
tu le sens là?
T'es à fond là?
Ouais.
T'es à fond?
Oui.
Oui, mais t'aimes pas.
Okay. He says nothing. Do you want the microphone? The microphone to the Cartier? So,
As my colleague, why not 5 passes or 7? Because I don't feel nothing. I was a little anxious before I start the treatment, but why 3 or not 5 or 6?
because
Histological.
yes, in fact, we have to spoken about the comparison for the clinical studies for the company classes is, of course, to do some clinical study in comparison with an old device that everybody knows, which was the liposonics system by Solta. And because, in fact, for all people and all aesthetic doctors that have known this device, it's quite the same at the beginning, because it is the same same waves that is IFU also. The cartridges are quite the same, with the same area of treatment. But the main difference, they have worked for the Classes company for the characteristic of the spot and the way of delivered the energy. And the main difference comparison with liposonics is absolutely no pain with this new device, SCIZER, because with liposonics it was awful. And this is the main new information you can get. Non, il n'y a pas de 9 encore disponible. Oui, mais il n'est pas disponible.
Mais on pourrait.
À mon avis.
Une action à différentes hauteurs.
So the question, I'm sorry, we have to discuss in French because it's more easier. So in fact, as you can see on the machine, you have already the C9. And the question from Dr. Cartier is, can you combine different depths during the same session? For me, I think it's quite a good idea. But we have to discuss about the protocol, because of course the two levels are very close, and perhaps it will be not a good idea in final. But we have to do 3 passes. We have to get the maximum level of 180 joules by square meters. This is the goal of each cycle on each site, whenever perhaps the different depths. But for instance, for flanks, I'm sure that you can mix sometimes 9 millimeters and 13 millimeters. So this is a good question. I have no answer for the moment. Okay, it will be the last. So, according to the demand of our doctor in the audience, it is now at the maximum level all the time.
So no cortisone, no antisteroid,
no anesthesia, no preparation, and after session, absolutely nothing. No. Any question? If you want to perhaps to go near the patient to see it works, it's not free. A problem. It's free. It's free. It has for check before. So in the audience, how many use some procedure for body contouring? Do you have devices? What do you use?
I was using liposonics.
It's painful.
Like permanently, yes. Right start. But also I was pulling the skin because when it was
could you give the microphone, please, to share the experience of Madam? So, in summary, you have a liposonics system?
Yes, I was using, I was making a lot of procedures, and before the session, I gave for patient anti-pain blockers, pain blockers, and so they were prepared. Usually paracetamol with codeine, like 2 tablets, and then of course we had some cold packs. It was my idea, yes, not from company, not Solta company, and but I'm very interested in this one.
Okay.
So I have Ultraformer. I'm
Also.
very satisfied, yes.
Okay, and which is the duration of your session with liposonics for to do, like for instance, a whole abdomen? How many times?
Yes, also the delivery energy was minimum 150 joules, yes,
and
but always I wanted to give 180, and of course it was longer.
It was longer. In my
Depends on
experience, it's a minimum of 1 hour treatment.
Yes, 40 minutes, 1 hour, sometimes more,
Yeah.
because sometimes we were making also other areas.
That's right. So as you can see, we will stop in 5 minutes. You have done the whole treatment of the abdomen in 20 minutes. Okay, and of course, if we have 2 handpieces, it's shorter. Yes.
So this is a treatment for fat reduction.
Yeah.
Many doctors already had cryolipolysis also.
Sorry?
Many doctors has also cryolipolysis technology, like classes. According to your practice, do you feel that there are some cases that match more with this technology and some others with cryolipolysis, or you think that it's good a combination because there are plus and minus? What is your opinion about, because we're talking about 2 technologies, very successful?
Yeah, I think we have to combine these 2 technologies. But from my point of view, in my experience, most of the time, you can be very limited with cryolipolysis, because it's a question, excuse me, Dr. Cartier, but in this situation, which handpieces do you have? Which size? You have huge one. The huge one with cryolipolysis are awful painful. Nobody says during the meeting, but it's very painful with the very huge handpieces. And in another way, in this situation, you have to put 2 handpieces, 3 handpieces, 4 handpieces. And if you have a device with just 1 handpieces, okay? How many times? 4 hours. More. 4 hours or more to do 4 areas of treatment. So in this case, you have my answer. Because in this case, you have seen 20 minutes to treat what could be 4 hours with one of the most famous devices on the market. This is argument for physician and for economic treatment. To avoid wave. And also we have wave, so not very good result. Okay, but of course cryolipolysis is a good device for good indication. Always the same, selection of patient. Thank you. Thank you for Dr. Cartier. The French team, thank you.